not knowing we are all God's creation. But one thing I want them to know, yeah, 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 no condition is permanent. You never know if someday you will find yourself in that same situation in this life. You've seen today, tomorrow is not promised. In a twinkle of an eye, your story might change. Be you black or white, no matter your personality. Be you rich or poor, your story might change. Cause no condition is permanent. Yeah. 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 Shout out to you, white priest. YUK man of the moment. I salute you.
Well, family, good evening and welcome to the program Body Tok, where they come to you every Thursday from 5 to 6 o'clock, even 10. Inside the program Body Tok, we they talk about different sickness, what they cause them, and self-prevention. And we they always get experts in the studio for talk about different sickness. Also inside this edition of the program Body Tok, we get the 3 studio guests them where we can talk on health issue them. When are the ears, the nose, and self the throat. Where with that, I want to welcome Dr. Daniel Barry, in the end specialist at the University of Salon Teaching Hospital Complex. As today we dey talk about health issues when are the ears, the nose, and self the throat. And where they present the program come to this Thursday evening, my name is Karifa to Conte. Remember, say yourself where they listen and watch we live on Facebook. You will be part of the program by way you go send a comment or text message to the number 077981981 or self you go now where the Democracy Facebook page. And later on inside the program we go open phone line. Also people go call the number 077981981 077981981 and the number where you go call later on and be part of the program. Ask question about the topic we do with today when health issues, and as we experts then at the studio where we can talk about this. Well, with that I want to welcome Dr. Daniel Barry in at the health specialist at the University of Salon Teaching Hospital Complex. Good evening and welcome to the program Body Tok.
Yes, good evening, and me Dr. Daniel Barry, an ENT resident from Chinese Hospital, okay. And we're here today for talk about ENT health issues.
Okay,
yeah.
So continue for the program. Inside the program, I want to welcome Paul Mansaye, in audiologist at the University of Salon Teaching Hospital Complex. Good evening and welcome to the program.
Yeah, thank you for giving this opportunity. I'm glad for coming to awareness to inform the phone in Nigeria.
Okay, continue for the program. I want to also welcome your other studio guest, winner Christiana Puchu Pende, and in charge for ends na the University of Salon Teaching Hospital Complex. Good evening and welcome to the program Body Tok.
Good evening everybody. I'm Christiana Puchu Punde from Chinese Hospital, the ENT in charge. We did now for talk about the ENT conditions, the way they affect the ears.
Okay. Continue for the now we come to Dr. Daniel Barry, in the health specialist at the University of Salon Teaching Hospital Complex. So for possible for the first day, but they say health issues. What do you mean?
ENT health issues.
Yeah.
Meaning ear, nose, and throat health issues that we can discuss about. So before we proceed, we want to say good evening to everybody. And we understand, say, a lot of people to just the ENT, but they don't know what's in an ENT. So we can clarify today, open up at least the least man will be able to understand what's in an ENT and what's in ENT they about. And of course, ENT mean ear, nose, and throat. Now we call ENT. So the doctor itself will not call him ENT doctor. That are just an abbreviation with the abbreviate. the doctor now otorhinolaryngologist, but because the specialty is so long, that name so long, so we can cut them short, say ENT doctor, meaning ear, nose, and throat. Because when you talk of otorhinolaryngology, otology is talking of the ear, which is the ace. Rhinology is talking of the nose. The laryngo is talking about the throat. You understand? So, in all together, we say otorhinolaryngology, and we abbreviate as ENT. In short, we can say also head and neck. So, let me explain to Fambulem what's in this ENT they about. You understand? So, why then combine first this ENT? Why then say ENT? Why then just pick this ace, nose, and throat for sending to one doctor for less specializing them? Why? So the reason being is that these them now interconnected organs them. This ear, nose, and throat now intra-connected organs them. They share anatomy, the same anatomy, physiology, and some diseases. So now in make we put all these things together. We say, okay, well, let one specialty go na this area. Of course, when you look at the current rate of ENT in a sort of, say we just get a one consultant in a doctor cabinet, now you know we get. So like people know too much, people don't know deep about ENT. Of course, since I came last year in this country, we understand say the area is so limited in a sense. Just one specialist in the whole country in a doctor cabinet. So it was very, very challenging when I came last year. And now they can explain to Fambulem about ENT, you understand? So ENT now don't become a major specialty within the surgical schools. And also it don't compass now not just only ENT, but also don't include head and neck. You understand? That is why I told you right from the earlier, say we get what to call head and neck surgeon. Understand? Okay. So not just ENTs, but now you don't include head and neck, and also cosmetic, facial, and skull-based surgery, all entitled to ENT people. So now in ENT, we get some condition that we will make awareness for the people understand. You understand? Because when you look at the kids that we can get, it's so more than they all now because people don't understand the basic things about ENT. You understand? But they get so many cases them, especially picking them. We can get picking where they just put foreign body at the nose, at the ears. We get picking where they, they get what we call otitis media. We get picking where they get tonsillitis. So now they can't explain all this in details, So before they start with the ears first. You understand? So we go brief history, the brief anatomic make for the ears. You understand? So the ears comprises of 3 layers. You understand? You get the outer, the middle, and the inner ear. You understand? So this outer we call the pinna, and in the for get a vibration. And the main function of this is now for this pinna now for gather the sound wave, send her inside the ear canal. This is where the system will go inside the eardrum. And of course, you get 2 main organs inside the ear, so we call the cochlea and the semicircularis. And the cochlea now in there for hearing, the semicircularis now in there for balancing. So these are the 2 most important organs them inside the ears we get. And we understand say the statistics. So we look at the total deafness in this country, it is just increasing. And according to the WHO, if they're not paying attention to that, in 2030, Africa in whole, it will go more than 25 million people.
How alarming in a salon?
Yeah, alarming currently in a salon, we understand say over 1.2 million. This is just approximately where we understand say then get deafness, both conductive deafness and sensorial deafness. You understand that? So, but we will explain all that to you now, how people will take precaution upon this deafness so that they go prevent. Because so they don't get already, so just go forget the normal how for prevent themselves from this conductive deafness. So now, like I say, we there on the ear, right? Yeah. So I don't tell you the layer of the ear. And now this is what you see. So you get what we call the earwax. We understand so this is not the major problem we get with people. People like for use cotton board inside the ear.
Well, we can look at the problem them as that. We will take them to Mr. Paul Mansaye for talk on the ear problem them. I want to make you take me through some of the common health problems the way people in the experience.
Okay, the common health problem the way people in the experience, of course, we get what we call otitis media, when an inflammation of the middle ear. We get what we call epistaxis, bleeding from the nose, you understand. Then it is caused by trauma, you understand, and by some sclerotic thing, the virus, the way they happen inside the nose, so they cause epistaxis. We also get tonsillitis, you understand, tonsillitis. We also get also called pharyngitis, inflammation of the pharynx. We get inflammation of the tonsils. So these are the major things. The more we see, these are common things that can happen frequently upon the case that we see tonsillitis, pharyngitis, and also.
So you can break it down for the.
I go break and down. Yes, I go for break and down. So pharyngitis now where the throat is swell, where it's a soreness of the throat. It's an inflammation of the pharynx. So pharynx now at the throat now what they call pharynx. You understand? So when it's swell, due to some viral infection there, and also some bacteria there like the strep. These are things where they cause also called pharyngitis, and common cold also they cause pharyngitis. For instance, we get certain people looking at them picking too much of ice cream. You understand? And those picking and then they get addicted to those things. At the end of the day, they develop difficulty swallowing, painful swallowing. It don't lead down to pharyngitis, and also they lead down to tonsillitis. They make the tonsils them where they under. They make it swell, which is very very bad. But we go calm and explain to people upon what they for do for prevent all that in there. We also get otitis media, more common in children, very very common, because they don't know when and how for clean the ears. Then if you say when they say ear wax, the wax is they are not so dirty actually. You understand? So like the ear wax, it is produced by natural sclerotic glands there, you understand? You get special glands there inside the ears where they produce earwax. One, we get the sebaceous gland, and they produce the oily secretion. You understand? We also get the ceremonous glands. These are, and they produce the thicker and the thicker and the stinky, secretion. So these are the two special glands where inside the ears where they produce, earwax. You understand? So now, how this secretion happen? It mix with those skin cells and tiny hair within inside the ears. You understand? And also some debris inside the ears from the environment. So now in all they form together, make a serum of what we call earwax.
Okay.
So now this now they form earwax. But this earwax they come out naturally. The movement of the jaw, they remove them by how the jaw, how they talk. You understand? How they yawn. They slowly push the wax come out. So, and you need less for you take cotton board doc and so
okay, we can look more into that. They continue for the between the program. And name now Dr. Daniel Bayi and at the end specialist at the University of Salon Teaching Hospital Complex. The program now will Body Talk. They come to a live from the Society for Radio Democracy 98.1 FM. Members say yourself can be part of the program by way of send a comment or text message. So the number is 0779191 or self you go now where the Democracy Facebook page. As still inside the program we talk about health issues we get to do with the ears, the nose and self the throat. Where we that around for come to me other studio guest winner Paul Mansare in a audiologist na the University of Salon Teaching Hospital Complex. So now Dr. Bayi don't talk about the ears, don't mention the different layer them and self. So now let's look at what are some of the problem then of where people can get with their ears.
We will talk about the code. Awareness and awareness among the code. And then when we know more, we help for both Facebook and self-esteem. And I want to continue. If I say noise, the humble person is, that's not sufficient. The person who can understand. To our explain, if you get a cane, you whip the air, you get one sound. You use another force for whip the second one, you get a different sound. That's they tell you, see. The sound not they come out from the cane and from the air molecules. Now the air molecules they vibrate, and they can at the ears. What I try to say is, the air is necessary for hearing, not just for oxygen for breathing, but for hearing. Also, look onto a guitar. If you get a guitar string, you tension the guitar string, you press, you get one sound. You press another one, you tension, you press, you get a different sound. Meaning the sound not they come up from the string, but they come up from the air. So all sound are vibrations. The sound not they come out of your mouth, not vibration. If the air not there, you no go able for talk. And nobody no able talk without open your mouth. If you lock your mouth desire for talk, you no go able talk. This now because we get the vocal cord inside the neck, inside the throat, when I am responsible for the sound. All speech get basic units. For instance, they, come. Okay. This chord here, you can modulate it, you can change the syllables. Yeah? But how? If you lift your tongue, you will produce one syllable. You push your lip, you will get one syllable. This they give you different sound. Yeah? The biomedical engineer they call this modulated signal. Yeah? And this modulated signal, we get what to call frequency, we get what to call amplitude. The frequency from that signal the way they come on your mouth, it vary with the produce sound. It is between 25 Hertz to 185 kilohertz. But that is not much important. What's important now the amplitude of that signal there, the degree of intensity, now they cause hearing loss, now the community. Now tell me the measure. For instance, what they talk to, this is what they talk to, they talk around 32, 34 decibel. Okay. We're going to traffic now around 45 going to 50, 60 decibel. Even 10 and then morning hour na PZ or Lumley turntable or the hospital, we go measure then 110, 125. This is not good for the human ear. Yeah? Not good for the human ear. For instance, if you run generator near you alter, then they bring you hearing level down. But you not go realize that. Then if you then pura, always tell the pura driver and say, low the music. It is above you hearing problem, it is diminution. If they work in a generator house, then big generator, it make you deaf. They work in them companies, they way then get them machine there. If you did it for long, it is deaf. By God, the company for pay you. You see, these are some of the problems then we encounter. So
apart from noise, what again they cause way person the deaf?
Well, biological problems, for instance, drugs. For instance, the sound, as I tell you, they come up from the mouth. It comes to the ears, yeah? It comes from the ears, like what doctor said, get the middle ears, you get the inner problem, yeah? Okay. All ten, this person, they listen to music, they damage what we call the cochlea. Yeah? And they cause stress, now the plate, just after the cochlea, they cause stress, they wear out. Yeah? At times on sound day, it will damage even the ossicles. Like what doctor have talk, the middle is bones there. It will damage them. Like for instance, a slap. A slap can dislocate the bone of the ear. Then the person will go hear it for life. So that make enough for slap body. Then pot cover. Not only dangerous for the one that they lack pot cover, but it's dangerous for all the one they are around. That creaking sound they cause problem like the cochlea. Not say for raise awareness of people. What people they at home where they use pot cover for bang. Just recently this crafting police station. I be able to admonish one woman. I say, Madam, you dey beat pankoba. You know say the pankoba is dangerous to use yourself. I said, no, not again. Now I'm Mr. Braimer, who then are the line manager, and I'm the deal with the matter. Now grafting police station. But they don't know where they don't know. So if I for raise the public, for tell the public the noise, a problem with the cause hearing loss. And now a hidden disability, which I mean, you feel say they hear, but not they hear. But something that you strain for the teacher, the lecturer. You see, now that thing they go say, I know they hear you. Or sometimes if you don't know, you miss go say, but when they come, buy for me sugar. There you go. When you come back later now, you not buy the sugar. You go say, Daddy, I know we just like buy sugar. You go say, you may tell me. Now because you miss some words.
Okay.
They miss some words. So here comes the hearing problem. Small. And some of them problem here, if you detect them quick, we go to Dr. Karim Cabinet. Dr. Karim Cabinet, they do the test. And when you do the test, he able to analyze inside the problem there. And he able to select frontline drugs for that particular problem there. But not go buy drugs na treat take am because it can make the cochlea damage more and more.
Okay, well, we can look more into that day on the drugs and the signs and symptoms. So now, the program Well Body Talk they continue, and remember, say yourself can be part of the program by way of sending comments or text message to the number 077981981, or self you're gonna wear the Democracy Facebook page. And anytime from now, with the open phone line, so people go call the number 077981981. 077981981 at the number where you go call later on and be part of the program. Ask question about the topic where they deal with today at the program when I end health issues where they talk about the is the nose and self the truth. Well, with that I want to come to my other studio guest when I Christiana Puchu Pende and are in charge na the Jewish Chinese hospitals and self na the University of Salon Teaching Hospital Complex. So Lord look at waiting at the condition them again where they affect the ears as that's now the way you go like for both so.
Thank you, Madam Moderator. Well, the condition the way they affect the ears, we get otitis media, we get wax impaction, we get hearing loss, we get otitis external. This condition then they're very dangerous to the health where they affect the hearing parts. And for the nose, we get sinus, we get polyp, then we get nasal congestion, then we get epistaxis. This condition are condition the way they affect the ENT areas. Concerning the throat, we get condition when thyroid. As we can see, majority of people that they pass along the town, they get their throat swell, they get thyroid, they don't know the right side for go. Like we can advise most of them will meet na street for go seek the facility when a Chinese hospital when a Jewish. And like perforation, we take a little perforation can cause trauma, continuous using of cotton bud, that can cause perforation. Then we get serious condition when a otitis media, otitis extra, CSOM, chronic suppurative otitis media. These are conditions where they affect the ace. And like the wax, people then can say, me picking get wax, but I don't know how to plant. Then they can take thing we harmful. Like some man can go take cotton bud, they push the wax closer to the eardrum, and that's not good because we need to advise people then for use ear cotton bud. We can get the way where you go meet when at the facility when a Chinese Jewish teaching hospital, we they teach them and orient them concerning the condition they like what I don't name them. So the foreign body wax impaction and traumatic ear injury. Traumatic it can lead to accidents. It can lead to like some man when a man or a woman they slap him, or you slap him picking in eardrum ke boss. So all this condition where you don't chronic, you don't know the right side, begin to pull pulse, and when that pulse they begin to come outside, and that particular ace go lead to hearing loss. And hearing loss, we get mild, moderate, and severe hearing loss. But before we they go to that level, they can go access the facility to we na Chinese hospital. We can go through a lot of series of tests. Them we can test them, then we position them outside. Then fit say maybe your hearing loss na mild. Then we doctor when Dr. Karim Cabinet when the consultants can put them on medicine. If you hearing loss severe, because we get severe hearing loss, we can get my boss can provide hearing aid. Yes, he can prescribe hearing aid and ask if he gets possible go BAM because all these things not they are available when are free. So we can, if he hearing loss kilon severe, my boss can say, well, you need hearing aid for help you for the hearing. Because if you not get some where you they work on at it, if them blow on you not go hearing. So this are the condition the way they affect the ace.
Okay, so you talk of ends, swells, way you call say plenty people they get them but not they understand also they for go for treatment and save how dangerous it be. One thing where come on that plenty people just they say I get sore throats, I get cold, I get sore throats.
Yeah.
So what do they cause sore throats?
Fine. The thing the way they cause sore throat, number one, severe cold can cause sore throat. Number two, when we get the habit of taking cold drink, you like for they take cold drink, you did all thing, you know they do without cold water, you did drink cold water, you did drink cold soft drink, you then under AC, all these things they cause sore throat. Then if you don't effect like where the tonsils can don't infect, if they get sore throat. The adenoid, if you don't affect, they get sore throat. If you get nasal congestion, where they get back nasal dripping, because the mucus for come out through your nose. Then now, if your nose block, you not able to breathe, you they get some back. Now we call back nasal dripping. So that's all. Now infection they go down like your throat, you go forget sore throat.
So how dangerous it be?
Very dangerous, because most of the time pass, like if you don't get that adenoid, where you don't become infect, pass then go do an operation. Then if it's not too severe, we can put her on medicine. My boss can put her when a doctor Karim cabinet, when a the consultant. We can put her on medication where they can resolve and it can well.
Okay, continue for the treatment at the program. In name na Christiana Puchupende in charge na the Jewish Chinese Hospital and Self the University of Salon Teaching Hospital Complex. The program Well Body Talk they continue, and yourself can be part of the program by way of send a comment or text message to the number 077981981, or self you go now where the Democracy Facebook page. And now with the open phone line, you go call the number 077981981, 077981981, and the number where you go call and ask question about the topic we do it. Then at the program when I end health issues, when I the yes, the nose and self the throat. Plenty people we don't experience plenty thing there, like once we come out they say we get sore throat. So what you want for nobody, and they call the number 077981981. As we get the experts in the studio, we go respond to the question. We don't get to first call on the program. Hello, good evening. In name and who side the call from? Yes, good evening. Name and who side the call from? Okay.
Question.
Okay, plenty. Thank you for that question. They will ask that the program. Well, this one, Dr. Daniel, this one they ask say plenty ten and the AC the scratch, the dirty, but now so not for the use cutting board and safe if you know how for clean it. So what did they for do doing ends when they experience then ten and
Okay, so in such cases, like we said before, it is normal for me the AC get earwax where we feel a dirty but not so dirty, because it get already play like the ear canal, meaning the road for inside the eardrum. So like in such cases we always advise say whenever you don't wash, when you feel itchy, you can use a white piece of paketan, white paketan like towel you wash with, you all so then you can apply them inside your ace with your hand towards you one finger. You will just put on, so you shake them inside it. That will be more preferable. But if you see it still the effect, then we prefer say you come by the ENT facility, because that we the last option that for lay we come professionally for you. Or if not picking, we can also say maybe then they use olive oil. Apply olive oil inside it, and then you go come off for yourself. And also, like I said, the movement of the jaw by charming chingom, and them also talking, that movement of the jaw, they move the air slowly out of it.
Okay, let's take another call now. Hello, good evening. Your name and who the call from?
Yeah, Rina Pakaba from Godwish.
Okay, Pakaba, go ahead and ask your question.
I get a question for you doctors the other day. This Bobby Chingola picking the yeast. In the Africa we they try for men until at times the Bobby they would leak, they come out now somebody yes they smell and no if they able men right? Now my question that if they go able men because that Bobby they are more people than Boku. Thank you.
Okay, thank you very much, Pakaba, for that contribution in the program. So, anyone can respond? It said Bobby water, we can go now the yes, it can affect her, they make it smell, yes, they rot in.
And they put water inside the yes?
Like, Comra, say where picking it soap, yes.
Okay, yeah, in such cases, of course, it's the personal hygiene very important in that scene, you understand, right? Well, get for taking time. And also, if you see and say that what it can bring onto with the health professionals them, and we can know how they remove them safely without no side effects, without no complete, no any issues safely, and that will be fine. You go out on the Jewish Chinese hospital with clinical days now on Tuesdays and Thursdays, yes, from 8 to 4 p.m.
Okay, so now let's look at people wey normally ki say I get sore throat or me nose I get sore, e just dey go buy different medicine and drink am. So let's look at the complication under there.
Yeah, and of course, these are most of the complications they will get. Like we are when a patient will get a nose go block. When a nose block, and they get a drug where they can use Otrivine. Well, these are just decongestants. You understand? These are temporary relief. You know, that moment they go relieve them for you, but as time goes, or within few hours, not even a day, within few hours, you know, it a recurrent back. You understand? It come again. So that is why we can always advise say, and when you feel a soreness of throat, you understand, we prefer people, you know, using the best natural remedy than go buy a drug where you don't even know the use of that drug. You say just for relieve the pain. You understand? We are in, if you get nose block, if your nose don't block, we'll get a simple procedure we can use the steam inhalation. We are in, you they get you warm water, you put them per cup, warm one, you know they drink a more member, you they just cover yourself, you inhale them. That vapor where they come inside the nose, it they relieve you with a moment day. You understand? And also we get some nasal drop the where we would advise say that they come to the right facility. Now the facility they will give you the best nasal drop, because of course right now we get so many nasal spray them, you understand, and most of them can get side effects, and they are just the decongestants for the moment. At the end of the day, it worsen the condition, so pass the patient get for come which with the health professional them, and it puts you for more work. At least so when you experience those things, make sure so you do for the natural remedy, and then if it persists, then you can push up kind of the ENT department so that we will take it from there. And of course for soreness of throat also, which is very common, caused by viral infection. Viral infection they cause that. You understand? Where we experience people they get soreness of throat, people they get hoarseness of voice, people they get laryngitis. So many throat diseases that people they get. So in that case of those people, we also get a natural remedy procedure where we can tell people that we are in, you get a the lukewarm water, you understand? We tell you to apply certain amount of hydrogen peroxide. But that procedure is difficult, so not they recommend them for all patients. So what we can do for that procedure, we just say put small salt in lukewarm water, you gargle them, you mix and then you spit them out. That will give you small relief, and then you can come and meet with the health professionals then, and then we go know what for do. We check the throat, because which is very important. We can't treat blindly. We check for know the site, which area we is affected, so we to make it get the soreness, and then we take it from there.
Okay, so take me through some of the signs them way of person you know say this person don't get health issues.
ENT health issues, right?
Yes.
Yeah. So for instance, now if somebody gets what we call rhinitis, which is very common, you understand, we get allergic rhinitis, and of course we get chronic rhinitis. So rhinitis na inflammation of the nasal mucosa. So what we call nasal mucosa, these are things the way they inside the nose where they produce snot, you understand. So like when this thing inflame, when it swell, it is give what we call rhinitis. So what are the signs and symptoms of rhinitis? You understand? You begin feel itch, you know still begin itch, you understand? Especially when you exposed to air condition. The moment you sit under AC, you don't begin feeling the itch. The moment you go dust, spot by you, they begin feel the nose. They get runny nose. You understand? So the moment you get this symptom, you say, oh, I need to see the ENT professional. When coming to the ears, of course, we get conductive deafness. When are temporal, they will get sensorial deafness, which is permanent. For the conductive deafness, a deafness we are in, possibly keep missing a wax go down can stuck in a serenum go down can stuck in the ear canal. You're not able to go outside. So that they cause conductive deafness. You go say you don't deaf completely, but not the wax and don't block them. So when they remove the wax and then you go free, you go get a hearing mark. So that is temporary, you understand? Or sometimes we also get what we call TM perforation when he undergone the boss. When he undergone boss, of course, instead can call to call conductive deafness. You understand? So
Okay.
you get sensorial deafness in more danger because it is permanent until we use what we call we give cochlear implant or we give hearing aid. Because that is a nerve damage. The nerve, you get nerve where connect from the cochlea, the thing I say day for hearing, it connects to the brain, you understand? So that thing there, that nerve there, when in damage, it get what we call sensorial deafness. So when you get done there, until you come into the health professionals then, we do you pure tone for see how far you hear, for know, ask you question upon, I mean, how you contact them, how you own day. Then we get mixed deafness, which is conductive and sensorial. You know, these are mixed deafness. So
Okay.
yes.
Okay, so why people can normally snore? Is it that?
Yeah, snoring. We can get so many cases them of that. They get snoring, they get sleep apnea. Sleep apnea now wearing and begin it go past sleep till it stop the breathing is stop and then it starts back for like 10 to 30 seconds. They start back and then they snore. That majority possibly caused now when the adenoids. So the adenoids they are there and then they trap bacteria, I mean they not go inside. You understand? So they are there inside, they trap bacteria, I mean they not enter. Where they breathe in, where they take in oxygen and where they swell out, and then they trap the bacteria, I mean they not enter inside. So those adenoids they get certain degree, they're not enlarge. But if they enlarge, when they enlarge, automatically they begin experience snoring. Even the tonsils are there, you understand? When they are up to grade 3 hypertrophic, meaning when you don't swell the tonsils, those helps they cause snoring. Of course, when somebody gets this viral common cold, you understand? And this common cold they associate with soreness of throat to make the tonsils swell, the adenoids enlarge, that can cause snoring. And in short, also when you tire, I would say, that the common one where will be regularly. In one case, you understand? When you walk, they remember saying somebody get cold. When you can't sleep, it is snore.
Okay.
Yes.
Okay,
So,
continue for the with me at the program. My name is Dr. Daniel Barry, in the ENT specialist at the University of Salon Teaching Hospital Complex. As today, they also for talk about ENT health issues when are the ears, the nose, and self the throat. The program now will Body Talk. They come to you live from the Society for Radio Democracy 98.1 FM, and where they bring to this edition of the program. My name is Karifa to Conte. Remember, say yourself can be part of the program by why go send a comment or text message to the number 077981981, or self you go now Radio Democracy Facebook page, or you call the number 077981981, 077981981, and the number where you go call, ask question about the topic we will do it then at the program. We get for tell you about the different health issues that we get for do with the ears, your nose, and self you throat. So now they come to me other studio guest when I call Mansare in a audiologist na the University of Salon Teaching Hospital Complex. So one thing where you mentioned is say noise. Now one panicating where they cause deafness. So how people were able to protect themselves from noise, being that we might say every day people get for day inside them with noise, then the activity, different activity they really cause noise.
The best thing to avoid.
Okay. How will they avoid?
Come from the noise. Limiter. Come out from the noise. Limiter. That they cause deafness. Another thing back for buttress to which doctor say, we very important to that caller will be first call. But this Bobby, what's a problem? This everybody for nobody, don't come them for nobody's. You see where you breastfeed, if for all you picking less you don't upright, for layer. This now because you get what we call eustachian tube, we run from back of the throat, take and sit on middle of the ears. If you lay the picking, as you the Bobby, the boy after the one can the middle ears. And where can the middle ears? You know the come I know they know. But over time, it build up bacteria. It build up bacteria, they make the ears rotting. So they pull that person at your ears. If you not treat her, it can cause that what they call mastoiditis. Why not treat her? Because you know what you mean. You want someone for life.
Okay. So again, now look at how come them go able for no say this may pick here so I don't born it don't lost another year again.
Well, like I go to we get series of tests that we can do to them. sister get one machine we.
If you don't know, same picking
Yeah,
on there
I
for
can come
water.
in. According to the question we asked Ms. Moderator, Komara for dictate is the one that you all say you picking it like some man can go to say this picking is stubborn. Even at class, if teacher go say this Alex if they talk, you need they talk. Then particular picking and they get hearing problem. So stubbornness for picking, if you picking stubborn I was checking hearing well. Then say gets hearing problem. Right?
So again, no look at now one thing again where Mr. Mansayebi mentioned, say drugs, now other thing really cause deafness. I want to make you elaborate more on that day.
Well, yes, I do. Well, drugs indeed na a problem na the community. Yeah? As I been say, drugs are dangerous.
Okay.
More farm is dangerous, less a problem. So, but the ENT surgeon specialist is so clever for select what we call first line drugs.
Okay. So
Yeah.
you can answer and the more take this call now the program.
Okay.
Hello, good evening. Name and inside the call form.
And I'm Mr. Abukonta, PC Doctor. And I program at the service for the listening to. This one is the toxinalization program in I get for that problem. I need to sleep to next camp. You know, so I report old neck, I need to sleep. I need to sleep for one. Even tell me body, I'm so clean. I don't go to hospital. They don't give me, they don't go check me, they don't do blood test. Nobody discover HIV. They say, I'm not going to come out. I'm not going to do scan. But another money, even the money for that pay for the blood test, not complete. No time for this talk to that.
Okay. Plenty thank you for that contribution in the program. So Dr. Asuna, I hear you from this caller. We okay, so go ahead and answer on the drugs issue.
On the drugs, okay. The drugs dangerous. More pharmacists say it damage the ears. Less na a problem. So, but the doctor so clever enough for selector to call first line drugs. If you select the drug, he give you the patient. If you know well, you come back. Eh? When you come back, you go select another drugs, okay? Or you go do what you call diagnostic. That's for find out really what's the problem. Eh? But not take drugs because what we call the cochlea inside the brain is so tiny, so delicate. It is the tissue. It gets what you call ganglion cells. Now they make up. It's so tiny, it's easy for damage. Even at childbirth, if the cochlea, if the umbilical cord twist, it deprive dangle of oxygen, ganglion cells they die out. So the picky the bone I know the area. Yeah. So
in addition to what my colleague just described for say, drugs, particular drugs, then the way they affect hearing. Number one, drugs na quinine. Number two, na gentamicin. Too much of using of that drugs they cause hearing problem. Like when people like you go take drip na hospital, some man where we can ask how comes you be there? He say yes. How comes you lost the hearing? He say I be go off, then go give me drip, then say the drip in him and quinine then put aside. So quinine are drugs where they cause hearing problem totally. Past week, he managed them, I like how my boss keep put them on treatment, supportive treatment for improve the cells then because they damage the cells. Then gentamicin, people don't get the habit of any aftin, give ampicillin and gent. Even small picking self, then infants when they get sick, they can say we get cold, give gent and ampicillin. Too much of using of those drugs they cause hearing problem.
Okay.
Right? Yeah.
So now take this other call now the program. Hello, good evening. Name and inside the call form.
Yeah, I depend on you.
Okay.
I depend on you.
Okay, go ahead and ask your question.
Because I'm not the question you want to make a use of better for the cleaner is.
Okay.
Yes, why do you use of better? I don't believe.
Okay, sir. Thank you very much for that question in the program. Yes, so they ask us where they use for feather.
Yeah, of course, like we say, anything when I'm metal, for putting inside the ace. For feather also not good for the ace, anything when I'm for anything not good for the ace. The only procedure we accept for the ace, like I said, when you feel itchiness, when you come over, just put your hand by the towel for plain white thing, small one, then you clean, use your one finger, clean your inside it, just make like this, and then it will be helpful for you. If you see say you feel more and more irritated, then you can consider the ENT health professionals. But wax, that thing where they call wax, where they're fixing a dirty, it is supposed for there inside the AC, you know. You need for there inside the AC because again you the way they create inside the AC. The only way they remove them slowly, like I said, the movement of the jaw, they remove them slowly. The way they yawn, they push them slowly. That is why sometimes they sit down, they don't come before. They feel like say it scratch when you make like they feel like don't come on. Because on the process of you churning gum or either yawning, you know, that's the movement of the jaw. You can remove them safely. So we advise say cotton board now, for feather now, anything on a metal or foreign body thing, iron now, ear pin. These are things that will not good for the ear, for clean the ears. Yes.
I want both yes. Fall feather. Eh? Fall not the worst. Fall feather get tumbu the way you know the see with your eye. If you pull your fall feather, we get that tumbu you put on your ears. The causiness of your ears is fine for the tumbu there. The tumbu they don't picking the pan ears. Then we'll put it and get problem for you. So no use fall feather.
In addition to what my colleague then just they say, fall feather na thing wey not good for put na you ace because na thing where they cause ear infection. We get one case where the woman left cleaning in ace with fall feather, where the fall feather go broke inside it. Now the ace begin for atom, begin pull pulse, where we call them tough. When we go, we look and through the machine, we see the fall feather, we end up for pull and we advise and say, whenever you feel you ace the scratch, now for use this your finger, use that small cell near outside and keyboard see again for we the woman then we call that nerves, tragus nerves. You make movements pan so you rubber. You ace go seize for scratch. If you don't contact cold, make sure say you go to the facility during Chinese hospital for make you go get treatment for that ace. And broomstick, some of we colleagues then, some of we family they get the habit for put broomstick in a ace where it not good. Anything where na this you fist, you elbow, you know able go inside you ace, you know for putting that in a ace. You ace for always they clean and intact. Like what me colleague say, Dr. Daniel, he say the ace nothing where in a sterile place. You no need for go offend am. When wax they way the charm safe they come out. When the young safe they come out. So with the advice make them not put cotton board, broomstick, fall feather, and some man get the habits for take pin. If they clean it is. You they go cause problem because if you go buster you canary or you eardrum, forever you don't get ear problem. So now that make with the advice everybody let you know they use fall feather, cotton board, you know fine for the user. Yeah.
Okay, so doc, another thing you want for it to like on the issue of nose bleeding. Yes.
Yes, of course, this now one of the most common, cases that we get nosebleed by trauma, by pinching of the nose. These are things the way cases that we get frequently, I can say. But like in such cases, you can see where person they bleed from the nose. We they see with family they take charcoal. They take charcoal and stop at the nose for stop the bleeding. So there is this case where when such incident happen, and then they try to stop charcoal and making your nose, so the thing just add for enter inside, just go right inside, go. Just would say injured, it also called inferior turbidity, just be the goal, just be the inside. At the end of the day, we end up the surgery for removing charcoal. So you don't see, they're trying to, their aim now for me to make good, but at the end of the day, they turn for them, So we kindly advise say stop using charcoal for epistasis, bleeding from the nose. So now, when you witness or you there in a scene where somebody they bleed from the nose, what in force they apply, even to medical somebody did it, they know everything. We advise say when you see somebody they bleed on the nose, you go there, make the person lean forward, you pinch the nose like this, you understand? You pinch up all the front part, when the cartilage, you all lean forward. When you lean forward and then you pinch the nose forward, 15 minutes. So in that process, the bleeding will stop. It depends on the site where the bleeding will come out. You understand? If it is trauma or if not by pinching the nose. So using that procedure, I explain, you pinch the nose like this for 15 seconds and then lean forward. You understand? When you lean forward, we expect the bleeding to stop. But if it persists, and then on that process of you pinching the nose, I get a procedure also where we give the patient water like drinker. So while pinching the nose like this, they give water back when they drink at the same time for try for cut off the bleeding. But if it persists, then you can bring them to with a health professional that we could do to call anterior nasal packing.
Okay, so doc, take me to the prevention them of the ENT health issues them as we not get better again.
Okay, so the prevention them for the ENT health issues them, of course, we know say ENT comprises of ear, nose, and throat. For the ear, the most important thing is personal hygiene, which is very, very important. You know, personal hygiene for the ace, we are not take anything where you just see and gone, put it inside your ace, no good. You understand? Anything where you just see because of you feel the ace they itch, you take a clean, take pen, take for better, take these are things that are not clean. So personal hygiene is very, very important, and also too much of when it comes to the nose, too much of air condition, exposure to cold. It's very, very dangerous, you understand? And these are some of the things the way they call rhinitis, sinusitis, you know. These are the most common things when it comes to the nose disease. So like we advise people, let's say, let them always stay away from, especially when you put the AC for you, right in front of you so they bang you, and also you get fan. You put the fan right in front of you so the breeze they come. It just they cause danger to yourself, you understand? So we advise you then stop that in the, and also, and we advise you not go to use your hand, clean the nose, you understand? You can use tissue, all the cartilage part, which is the frontal part of the nostril before you enter, just all on like this, and then you can clean the nose, you can wipe off anything where come out discharge, you understand? So these are common things. And also for the throat, we just advise you just stay hydrated. It's very important, especially for tonsillitis, you understand? The most important thing is stay hydrated, and smoking also, give us stop smoking. When the patient stop for smoke, when the individual stop for smoke, that they make come close to what we call tonsillitis, pharyngitis, you understand? It go difficult for like get viral because most of the things are not through common cold. How they get influenza, some other stuff there. So when you stay hydrated, you understand, you get your personal hygiene. You know, say you ace not for the dig and too much, because there are things that there where they are made. They are meant to be inside there because they get certain role where they play. You understand? Okay. So when you feel irritation, just go to the healthcare facility. So that we can see. And
okay. Yeah. Okay. So now we come to Mr. Paul Mansaye. Himself go tell we a last message on how people for prevent them from deafness.
Number one, slap your company. Number two, avoid using noise, the persistent noise. Especially you young boy, that workman, all temper workman, it will diminish you hearing. Until the you get problem with learning. You generate to attendance. Avoid, put air plug in your ears, otherwise you go deaf before you retire. Una work na them factory them, una call the factory, una let them buy a plug from una. So that it will protect una ears. Now that's not my would tell people for now.
Okay, so now we come to Christiana Puchupene for tell we and also message we go give to people on ENT health issues.
All right. So my own message, I just want to tell the young girls that we then get the habit of piercing their ears now this outer canal, which it cause keloid. That particular condition, a condition where people they take a light, they can get here where they bust their ears from upside down. Some man don't know in clotting factors. You blood, you don't know if it a clot or in a clot. As you bust them, it begin for the begin for swell, the blood no dey ever clot again, so we call am keloid. Then if you get condition like that condition I will explain, so you get foreign body, you get perforation, you get hearing loss, you get accidents where you go through, you ace, you know the yeri, you go meet with a Chinese hospital, when a teaching complex. Then for you will get sinus, then you will get polyp. Then for the man they dey smoke, I dey advise me let them left for smoke, because smoking can cause cancer. Now the throat, we get condition the way we dey most of the man the way they go see we na the hospital, they get cancer of the throat, and we can advise them say no for moderate on smoking. Smoking can cause that. Then for the bleeding, the epistaxis, like the one the way they play football, you know, go for the mind how una dey kick ball per una self, because we dey get cases the way they palm the ball and they nose them, it they broke. Then fats, avoid fats, because some man like for fats, so when you fat them blood and nose. Then slap back, you the person, or we like for slap you pikin, or you the man or one we like for slap. We dey get case the way we dey get na hospital when a perforation. Some of them we ask them, wetin make you ace boss? You say that me man slap me na me ace. Some man go say na me woman, na him dey clean me ace. You see that white thing, you know nothing na the eardrum, because you don't know it go burst the eardrum. So all these things here, so we dey advise no una left for the do am. If una find out una get in condition, they una seek the facility. We get Chinese hospital, we get Connaught hospital, and we oversee our when are the specialists, when are the consultants, when are Dr. Karim cabinet, and Chinese hospital we get the Chinese name. We get presently we get Professor Chai, we in safe good, we in otology specialist, it good for the ace.
Okay.
Yeah.
Okay. Plenty thank you we join me at the program, and name na Christiana Puchupende, in charge na the Jure Chinese Hospital. Plenty thank you we join me at the program. We also want for tell plenty thank you to Paul Mansaye, in the audiologist na the University of Salon Teaching Hospital Complex. Plenty thank you we join me at the program, and also to Dr. Daniel Barry, in the ENT specialist na the University of Salon Teaching Hospital Complex. As today inside the program well body talk, the media also for talk on ENT health issues when are the ace, the nose, and self the tooth. One for say plenty thank you we join me at the program. Well, now this edition of the program well body talk go left una for today, Thursday, December 4th, 2025. Plenty thank you to me producer Musa Kamara, Fatma Tasama, or make una watch you live on Facebook, and DJ's School Face for in technical support, and we present this edition of the program well body talk. My name is Kaifa to Conte.
The true voice of the people.
Lady Courage. No condition. The condition is